Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about cardiac disease and menopause and perimenopause and all that great stuff. And before I get into it, a few things I want to make very clear is we are definitely not giving any type of medical advice. So if you have any questions about your heart or your health or anything at all, please go see your friendly neighborhood healthcare provider. And if you have any questions about your religion, please speak with your neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am so lucky and happy to have on with me Dr. Jayne Morgan. Dr. Morgan comes to us from Atlanta. Is that correct? Georgia?
That's correct.
And I will let Dr. Morgan introduce herself to the viewers in the audience.
Thank you, Sadaf. My name is Dr. Jayne Morgan. I am a cardiologist and have spent a good part of my career really doing a lot of cardiovascular research, doing the research itself, working in R&D, which is research and development in big drug companies like Solvay and AbbVie, and also running huge study clinical sites, for instance, at Piedmont Healthcare, where I led the cardiovascular research program there, and then research strategy across the system, and then the COVID task force before I branched off really into communications and community education, which is where I spend a lot of my time now, focused a lot on women's health. That means menopause, it means pregnancy, but also on minority issues, because all of these issues that impact women also doubly impact communities of color. And so since I sit right there at that intersection, a female, a woman of color, a physician, I can sort of speak about it from all areas. I was just talking with Sadaf before we came on, and we both have been honored with awards from our colleges and universities recently. So we were both awarded the Distinguished Alumna of the Year award, and I just received mine. So totally thrilled about that. And congratulations to you, Sadaf, as well. And so, maybe we're doing some things right. Maybe somebody listening, maybe this is important.
Yeah, absolutely.
I've also received the NAACP award and, the Atlanta Business Chronicle and numerous other awards, I think, as people begin to recognize the importance of having a scientific voice in the midst of all of this noise, in the midst of many people talking about health, but actually don't have health backgrounds, are
Yes.
self-trained or self-advocating. And one of the things I was thinking recently, Sadaf, before we get started, is that healthcare is one of the only areas where we actually listen to people without healthcare credentials.
Oh,
Like, we
100%.
would not hire a hairdresser to be a contractor at our house, or we wouldn't hire an architect to do our banking. And
Right.
yet we have all kinds of bizarre people with no credentials at all that people listen to for healthcare. And just because they have a big platform, people follow them and they have absolutely no credentials whatsoever. So it's baffling to me. And I think that's one of the reasons why Sadaf and I have received awards from our colleges and universities, because we really work to break through the noise, make certain you look at listening to people who actually are trained and experienced in the area in which they are speaking.
100%. You are absolutely right. That actually reminds me of a story of I was checking, when I first started talking about menopause, perimenopause, and sexual health on my social media platform. Somebody asked me to look up someone else's platform, and they're like, oh, she talks about social, sexual health, whatever. And I went and I looked up her platform, and she ended up being an occupational therapist.
Right.
And I was like, wow, that has nothing to do with sexual health. And she's talking to people about sexual health. So,
Right.
100%, I agree with you totally. And
And at least occupational therapy maybe could be parallel to healthcare.
cool. Yeah, yeah,
People who
absolutely.
have absolutely no connection. They are mechanics or
Yeah,
pilots
yeah,
or, whatever, accountants or bankers or, housing directors. And suddenly they come on to tell you
yeah,
that you shouldn't listen to your doctor because they know better. And you need to
absolutely.
follow this naturopathic medication pathway. They have absolutely no credentials. And so it's so
100%.
frustrating to not only get the information out, but to also constantly combat misinformation from disingenuous people. Some are well meaning and just should not be talking, and others are simply disingenuous.
Yeah, absolutely, absolutely. So I'd love to get into the work that you do. So I know that you recently went to the White House
Yeah.
and advocating for women's health, but also women in research, I believe, right? And specifically, is it Black women in research? Is
Right, Black women in clinical research. I was the keynote speaker there for the second year in a row, and that conference is really growing. I received an invitation to the White House with the Medical Association of Georgia. I went there with a delegation just last week, and I was also speaking on a panel at the American Heart Association in Chicago also last week. So I've had about a 10-day span of travel that
yeah,
came up unexpectedly. So I'm taking a deep breath
yeah,
and joining everybody today because that travel came up unexpectedly. But all good news. It's a lot of work, but it means that people are interested. And currently I'm the vice president of medical affairs for Hello Heart, which is a digital heart health company. And I am focused on women's health. And as we focused on blood pressure, we monitor blood pressure remotely and then provide information in the app for how you monitor your blood pressure. What are your trends? What should you be doing? There is learning on it. So we understand what your habits are and can give you coaching as to which habits are good and which habits are bad. But we are also building out our women's health feature. So we'll be building out a big menopause algorithm, a big hypertension in pregnancy algorithm, so that women can also come on at these particularly critical periods of our lives when we can develop high blood pressure and increased risk of heart disease, and begin to empower ourselves with how we manage our blood pressure, how we know what it is, how we know how it connects to heart disease, and how we know to advocate for ourselves when we go in to see our physicians as well. And so that's all of the work that I'm actually doing. Like my day job. My day job is also women's health, focused on menopause and pregnancy and hypertension, and developing these algorithms within our app, within our blood pressure monitor, to continue to expand our demographic and make sure women and populations of color have the tools that we need, because oftentimes we're the ones who don't have access, or we're afraid when we come into the office, or we leave with more questions than we entered, or we think that we're being judged, so we just never say anything. We're frozen, and you never really have a good understanding of your heart health. You never understand how menopause connects with it. And so that's what we're doing at Hello Heart. And I'm building out questions for your specific situation that you can then take to your doctor. So if you forget your questions or you don't even know what to ask, you can just hold up your machine and go, here are my questions. I need you to answer them.
That's
So
fantastic.
all of that is to continue to empower women as we go through menopause and go through all the beautiful phases of our lives. We are complex and beautiful and not ordinary.
That's for sure. So, absolutely. I think that so many things you brought up. Of course, we know that high blood pressure in pregnancy is a big problem. We know that those women that develop high blood pressure in pregnancy often develop high blood pressure after the pregnancy and continue with that. We
Right.
know that women, the biggest killer of women is heart disease. We know that in menopause, women's heart can develop heart disease, and we know that the role that estrogen plays also in helping women with that. It's interesting that you talk about women advocating for themselves, because this whole platform, that's the whole reason why I'm doing this podcast, and my whole social media platform is to empower and educate women. I think that often, just like you mentioned, women of color and women that perhaps have not had the resources are often the ones that end up suffering in silence. So it's really, really important, the work that you do to help with this advocacy.
Well,
I'm curious to know about, you also have, is it a live show that you do? Is it called Her Health?
yes, healthy her. Thank you. And I'm going to start promoting it right after Thanksgiving.
Yeah,
But
tell me about
healthy
that.
her, thank you so much. I have a talk show.
Yay.
Call Healthy Her, right up my alley, focusing only on women and women's health, including an entire episode just on sexual health. You may want to listen, but we talk about all things that are specific to women, our emotional health, but also our mental health, our physical well-being, things that we have to manage, things that are specific to women that have taken a back seat or no seat at all. We don't even get a seat in the car. Nobody even talks about it. So that's silent suffering. I have filmed 6 episodes. They went live November 1st. They're on YouTube at the AIB TV network, and also on that website. But I will also start posting them right after Thanksgiving, December 2nd. And you can follow them on my social media pages, and I'll give you information on where you can track them elsewhere. So on social media, I'm Dr. Jayne Morgan, DrJaynemorgan, Dr. Jayne Morgan. You can find me on Instagram, LinkedIn, Threads. I'm on a lot of places, TikTok, and I'll be posting those. I do a lot on Instagram and LinkedIn, but I do post on other places as well. 6 episodes, full episodes. I have all kinds of guests on there. They are super interesting, super non-traditional, some of them non-conformist. So we just let it go wherever it's going to go. If people are interested in 2025, we will film more episodes of it. So it's called Healthy Her, all one word, but the 2 H's are capitalized, Healthy Her. And I hope you tune in and watch it. I am hosting it. I think it's pretty interesting, and it's time that we had a medical, scientific health show that's just for our health.
That's amazing. Well, that sounds fantastic. I'm wondering, and I'm curious to know what you think about how systemic racism plays in women's health, and specifically in women of color. We know that sometimes, we know through the SWAN study that was started in 1994, and the multi-center study that looked at women in midlife, and noted that women of different ethnicities go through perimenopause for different lengths of time and experience different symptoms. We also know that due to weathering, right? That the DNAs shorten, the telomeres on the DNA shorten and can often make women susceptible to diseases. So I'm wondering what your take is on those topics.
Yeah, I'm so glad you brought up the telomere shortening. I often give whole talks about DNA and telomeres. And so for your audience, telomeres are the end caps of DNA. And generally, the longer the telomeres, the younger the person is. So they are a rough measure of the age of an individual. And as we get older, those end caps, those telomeres shorten. And so they give us a rough idea of age, sort of like in trees, the rings on a tree give you the idea of their age. So this is how we also know the age of an individual by DNA. And as it turns out, Black women, in comparison to white women, have shorter telomeres as we age. They begin to shorten more rapidly. And so what that denotes is a more advanced biologic age. In other words, your body now is older than your chronologic age. Or another way to put it is your body is older than the date on your birth certificate. And so
Mm.
the question then is, as you see more and more Black women suffering from chronic diseases earlier and earlier in life in comparison to white women, the question is, should a lot of these preventive health screenings be based on the length of your telomeres and not on the birth date of your birth certificate?
Wow.
Because if you are aging more rapidly, then breast cancer screenings need to begin 10 years earlier. Colonoscopy needs to begin 10 years earlier. The blood pressure screenings and those types of programs need to begin based on your biologic age and not your chronologic age. And I think, there's a lot of support with that as I go out and give these lectures and move around because we see the high death rates and the chronic burden of disease, especially in Black women. And when we talk about menopause, just as you said, we generally suffer menopause longer.
Yeah.
We go into it earlier, which means earlier menopause means an earlier start to heart disease. And then the symptoms that we suffer can be more severe, more intense, and the duration can be 10 years or more, as opposed to other races have shorter durations of menopausal symptoms. And most people think, hot flashes and night sweats, and those can certainly be very debilitating, and we see a lot of those in Black women. But there's a myriad. There are 84 symptoms of perimenopause and menopause. Those are the ones that people know the most. But then there are all kinds of other symptoms that even women don't know. So we don't even recognize that we're in menopause. You may have a number of things going on that might take you to 3 or 4 different doctors, and none of them are connecting the dots.
Yeah.
Nobody knows what it is, and it's really just one thing.
Yeah. Yeah, absolutely. It's interesting that you should say that because as we know, the mean age for somebody to go through menopause here in the US is between 51, 52. And if we subtract the 10 years that African American women tend to go through perimenopause, that puts us at 42. So you're saying that maybe even before that time, like for women, women of color, perhaps starting that conversation about perimenopause, menopause in their 30s,
Yeah,
right?
so what I was saying is the advanced aging of the body, but what we see with menopause is that we enter menopause about a year and a half earlier. The 10 years is based on the biologic aging of your body with chronic diseases. We do not see menopause and perimenopause starting 10 years earlier, but we do see it starting earlier at about a year and a half earlier. So that also increases your risk of heart disease because heart disease is related to the amount of estrogen protection oftentimes that you have on your heart, because estrogen acts as an anti-inflammatory agent, and inflammation is one of the risk factors for developing atherosclerosis, or what we call plaques in our arteries. And those plaques can get big enough to block the artery and cause a heart attack, or even rupture and cause a heart attack. So that's how estrogen and menopause connect to increase your risk of heart disease.
Mm. Fantastic. So I know you mentioned about, heart disease in women in the reproductive age a little bit, during pregnancy. We talk about high blood pressure.
Right.
And then, we're talking about heart disease in women in menopause. Often we hear OBGYNs and high risk doctors say that actually pregnancy is a window into your future.
Hmm. Yeah.
So,
We say it another way. We say pregnancy is the first stress test that a woman has.
mm,
Because from a cardiology perspective, like an OBGYN would describe a patient as, a 32-year-old pregnant female with high blood pressure. A cardiologist looking at the same patient would describe the patient as a 32-year-old female with volume overload and a failed stress test. So that's why it's important for the physicians to come out of their silos and talk with one another,
yeah,
because pregnancy is your first stress test. And if you develop high blood pressure or preeclampsia or even eclampsia, or even diabetes, gestational diabetes, you have just failed that stress test. And like anybody who's failed a stress test, you would be referred immediately to myself or some other cardiologist for further workup. That handoff doesn't happen because we're not recognizing this, but we need to look at pregnancy as a stress test. It is a volume overload of the body, and how is the body able to handle that volume?
amazing. So there's now been some through ACOG. There's been some universal mandates about starting all women on aspirin after the first trimester to prevent their risk of preeclampsia and eclampsia. What would you say to that? Especially women. We already did that, for women that had a
Mhm.
history of preeclampsia, but
Right.
now we're doing it universally.
Yeah, and that's interesting, and generally, when I've seen those studies on aspirin in pregnant women, it has been started before 20 weeks
Yeah.
of gestation,
Right.
and so I think I'm happy that there is some focus on this. I think I have spent years talking about it until I was hoarse. I didn't think that I was getting anywhere, and you know what? Slowly, people do start to listen, and then more and more voices lean into it, and then there's something to that, and then you see the research on it, and now we even have areas, some of our medical facilities, they have cardiac OB units where the cardiologists and the obstetricians are working together in the unit, as opposed to having a handoff, which oftentimes doesn't happen. Now the cardiologist is a part of that team that's managing that patient, and so I think even the data on aspirin is incredibly promising because it means that eyes are on it, focus is on it. Women's health is important,
Yes.
and that research dollars hopefully will be next. And we will get research dollars and funding for really good clinical trials and really good data.
Absolutely. So I'd love to focus now a little bit more on menopause, and you mentioned a little bit as to the changes that occur in menopause as women get older, and maybe we could talk a little bit about what happens with estrogen. If a woman decides to go on hormone therapy, and those women that decide not to go on hormone therapy, the difference in their cardiac risk and what happens.
Yeah, and so because as we get older and start to go through perimenopause, which can start as early as 35 years of age, remember there are about 84 different symptoms. It's not all about night sweats and hot flashes. So, starting at about 35 years of age, an average, estrogen levels begin to decline. So you really have officially entered perimenopause. Now, here's what's interesting about that period of time, like let's say between 35 and 45. You're actually in perimenopause, but you can also still get pregnant. So you're in that middle window. So just, I always want to say that because people sometimes equate menopause and perimenopause, like, oh, I can't get pregnant then. I'm in menopause. No, you're in perimenopause, and perimenopause does not mean that you are no longer ovulating. It means
Correct.
that your estrogen levels have started to decrease. So you can be in perimenopause and also be pregnant at the
Yep.
same time. So I want to make sure that I make that clear. So as your estrogen levels decrease, estrogen protects the heart. It's a cardioprotectant, works as an anti-inflammatory agent. And as those levels decrease, then your risk of heart disease increases. Now, how does that happen? Well, it happens because that direct impact, that positive impact on the heart, but also Estrogen is in other places in the body. In fact, it's all over the body. So it's also in the arteries. And as your estrogen levels decrease, your arteries begin to stiffen. They're not as elastic. We call that elasticity in medicine. They're not as elastic. What does that mean? That means your blood pressure starts to go up. Estrogen and cholesterol share common metabolic pathway in the liver. As the estrogen decreases, what happens? Your cholesterol levels start to increase. As your estrogen and progesterone levels decrease, what happens? You have sleeplessness, insomnia, and we know that duration of sleep is related to heart health. In fact, data
Mhm.
shows that you need at least 5 hours. Women who received less than 5 hours of steady sleep per night had an elevated risk of heart disease. And that means uninterrupted sleep. So, what can happen with your sleep is you actually may fall asleep, but you have multiple awakenings during the night. Or you may be on the other end where you just have trouble falling asleep. And by the time you fall asleep, you can only get 2 or 3 hours of sleep before it's time to get up the next day. Both of those put you at risk of heart disease because you're not getting 5 hours of duration of uninterrupted sleep. So that's how estrogen directly and indirectly puts you at risk of elevated heart disease. And then the last thing is, unfortunately, start to put on weight. Metabolism slows, but the weight isn't, in a beautiful uniform place. It starts to gather in visceral fat around our bellies and around our midsection. And you really cannot exercise that away. And so we talk about what are anti-inflammatory diets that you should have, what types of diets you should be on in menopause, because what we often hear with women is, oh my God, I'm eating the same thing. I've even started exercising more and I'm gaining weight and my stomach is sticking out. That's because of visceral fat. And unlike other fat, visceral fat is actually metabolically active. And so the fat that you see in your belly may also be inside of you and encasing your organs as well. That's why it's important to be aware of it. And just at a high level, a lot of diets that are plant based actually are better for you just overall, but certainly better during menopause. Plant-based diets, and then a lot of protein added to that to keep up your muscle mass because you can have muscle atrophy and bone as well. So protein added as well as plant-based diets. And I try to say that because a lot of times if I use the word vegan or vegetarian, I meet patients and they're munching on potato chips and munching on stuff that, is supposed to be diet, but it doesn't have animal fat, but it's got all these other trans things and artificial this and that, including the vegan meats. Many of those vegan meats are nothing more than processed food or even highly processed foods. And processed foods increase inflammation in your body. And you say, how can it be processed? It's all plant based. It is and it isn't. It is plant based, but the definition of a processed food is that it undergoes multiple steps in the manufacturing process before it reaches its final product, which means the original product has been changed. That form has been changed significantly. In addition to that, there are many things that are added, like to make it into that nice shape, the meat, the shape, the forming. You have to add methyl cellulose. If you need flavor or texture, you're adding sometimes synthetics to it. And so, yes, technically it's plant based, but no, technically it's not plant based. And it's also processed food. It definitely fits into the category of processed food. So, buyer beware of vegan meats because you're eating a healthy diet, you actually might also be doing some damage to yourself. So that's just a little tidbit. I went on an aside. I thought I'd talk about diet for just a second, but that's why I make a point to always say plant-based and not vegan or vegetarian, because a lot of snack foods, people find ways to eat around all that. And so I just want to say plants, and protein. And protein can be lean cuts of chicken and lean cuts of turkey and salmon and also beans. So I just want to be clear that I'm talking about whole foods that are in their original state. And that's why I make a point to say plant-based and not a vegan diet or vegetarian diet, because technically a lot of bad stuff can fit into those areas too.
Well, I really appreciate you clarifying and talking about all those different forms because you're right. I think that oftentimes people will say that, I'm doing a plant-based diet and then they have the artificial chicken or the artificial sausage or the burger or all those things. And you're right. There's so many different ways that we can ruin our foods
Right.
so
Right.
that,
And
um,
and it's sold as healthy, and you don't know that. You're like, I'm eating vegan sausage, I'm eating vegan, and nobody tells you what it really means. So you actually are making an effort to
yeah,
have a healthy diet, but being, fooled by deceptive advertising.
yeah.
Um, and so that's why we're here to kind of break down the myths. And
That's right. That's right. So I'd love for you to give some tips to say, let's say to menopausal women on how to protect their hearts, how to live healthy, how to, in this next phase of life, say if they don't, I know you mentioned that estrogen was anti-inflammatory and is really important
Mhm.
as we age. But what if a woman, oftentimes I'll get women, and I'm a Menopause Society certified practitioner, and I have women that come to me and say, well, I just want to do things naturally. I don't want estrogen. I don't want to take hormones. Those things are not natural. And I just want to do things naturally. What do you say to them?
Yeah, and I guess, it depends on what your definition is of natural. Estrogen is
Yes.
naturally occurring in the body. So as we lose it, are you re- replacing nature, something that you have that's already natural, or do you think it's not natural? So it depends on what your definition is of natural. But here's what I always say about hormone replacement therapy. Please have the conversation with your physician or with someone who's menopause certified. Do not deprive yourself of the conversation and the information. At
Yep.
that point, then make a decision that's right for you. Every
Right.
decision is not right for every person. But
Right.
what I don't like to see is ba- people making what they call informed decisions based on disinformation or misinformation. So now we're back to you're getting information from all kinds of sources except for people who actually know what they're talking about and who actually have the credentials and actually have the training and actually went to the school and actually went to the degrees and actually work in it, actually have the experience, right? You're talking to everybody else and you're like, oh my gosh, this is not for me. It's not natural. I don't have any problem with anybody making that decision, but I want you to have the benefit of having a conversation with somebody who actually knows what they're talking about from a credentialed scientific standpoint.
Yeah.
And then you make an informed decision that is best for you. We
Right.
certainly don't push hormones. We certainly don't not push them. I'm not anti estrogen. I'm not pro estrogen. I'm pro women being empowered to make the best informed decisions for themselves.
Absolutely. Absolutely. I think that's a fantastic answer. I think that so many people, well, first, I would like to say that I think a lot of people of color don't even get that luxury, right?
Right.
Of making that decision because they have sometimes they have those decisions made for them. I mean, I went to go visit Pakistan.
Mhm.
And when I went there in February and in March, estrogen and progesterone are not even available. It's not
Right.
even a choice. It's not that they even get to make that choice. It's just not available. They
Right.
don't have it. They don't have vaginal estrogen. They have nothing. So, as we know, women's, sexual health suffers when they don't have that vaginal estrogen, and women's health in general suffers when they're not able to make that decision for themselves, whether or not they want estrogen and progesterone. Even here in the US, we know that a lot of physicians, after the WHI study came out and those results were given in 2002, a lot of physicians have not moved past that. They haven't gone and done the research and looked to see whether or not those results were debunked, what those authors were saying. And so they're kind of still stuck in that 2002 mentality where, no, we don't give estrogens, we don't give hormones because they're bad. Whereas now we know that there's so many benefits to hormones, and there was even at that time, right? But they don't know that, and they haven't really kept up with what's going on, and they still don't offer those medications to people.
Right. Right. You're so right.
Yeah. I know that even in low resource settings, right? We don't, when we're seeing multiple patients, I work in the Bronx, I work 1 day a week, and I do their menopause and their sexual health clinic there 1 day a week. And I know it's hard to give that, all that information in like 15 minutes, right? Because
Right.
that's usually what you have in between patients. You have 15 to 20 minutes.
Yes, a
And
lifetime of questions, and they give you
Mhm.
15 minutes to try to understand it and sort it out. And,
Right.
again, we're back to women's health. All of this just doesn't work. It's the
Right.
system that doesn't work for women, and that's just a great example.
Yeah. Yeah. You just don't have that time. And, you'd love to spend more time with individuals, but, you're always running behind and there's always so many patients. So, anyways, I think that, one way to change that is just to have different models of medicine that we can practice, right? There's concierge, there's direct care, there's direct primary care, where you're able to spend that time with those patients so that you can give them all that information. So, Dr. Morgan, I'd love to know, do you have any pearls that you'd like to leave the listeners with, and tell them any words of advice, anything that you wish more people knew about?
So I would say take care of your bone health. And the way to do that really is just to exercise. And even though weight bearing exercise is really great as we get older, you don't have to be in the gym just, deadlifting weights. I am a Pilates instructor. Pilates is a great way for resistance training. In fact, when I travel, I always have my band with me because it is so lightweight. It weighs nothing. It can fold into anything. It's just a band. And I can do things in my hotel room. I'm not carrying weights around. I'm not, carrying really anything. Um, so Pilates is what I do. I have 17 certifications. I do it all the time. I teach. I have my own school. I teach 3 times a week. But believe it or not, now I'm going to say something else that seems the antithesis of what I just said. I'm not actually preaching Pilates. That's what I do. And that's what I recommend. What I'm going to say to you is pick some activity that you like to do and do it every day for 30 minutes. If it doesn't have any resistance to it, try to add some resistance. So, for instance, if you like to walk, maybe you could buy a weighted vest, a lightweight weighted vest to wear when you walk, just to give yourself a little resistance. Pick an activity. I picked mine. I picked Pilates. You pick yours. Pick your activity. This is now we're at the American Heart Association recommendations, and just do it for 30 minutes every day. I'm trying to help the American Heart Association simplify their recommendations because currently I think it's complicated and I think people don't remember it. It's like you can exercise for 30 minutes at high intensity, unless you're doing moderate intensity, and then it's only 45 minutes. You can do it 3 times a week unless it's moderate. And it's all over the place. People are like, what? I don't know. Am I doing moderate or am I doing high intensity?
I
So
know, right?
here's what I say. 30 minutes a day, 5 days a week in an activity. You've got free range, pick whatever you want, whatever you do that gets you moving. And then over time, we don't want to give you too many things to think about. Figure out how you can add resistance to it, including maybe you just walk with some weights in your hand, or maybe you do some knee bends while you're out. Whatever your activity is, then over time, figure out how do I add just a little bit of resistance to this so we can continue to age, not just gracefully, but age in a healthy manner where we can prevent falls and prevent fractures and continue to have a really good quality of life.
Yeah. Exercise is so important, right? And I think I love what you said about consistency, because that's really where it starts, right? Is trying to be consistent in one thing. And, I look at those, by the way, I look at those heart, the AHA exercise recommendations, and I myself get so confused because I'm
Right.
like, is it 30 minutes, that 40 minutes? What am I doing? I don't know, 35, 5 days, 7 days, how many days? So, but I'm glad you brought that up because that is
And when
confusing.
you're reading it, it's very clear. But for
Yeah.
some reason, it's hard to remember. Like, okay, wait, was that Monday, Wednesday, or was that 5 days a week? Was that 30? Was it, it makes sense when you're reading, but you can't recall it.
Yeah.
So it's not helpful if you can't recall it.
Right,
Right.
right, right. So I agree with you. I think anything, done consistently is really what you're aiming for. And I
Right.
love the fact that you said, to add resistance slowly and,
Mhm.
you don't have to be lifting up, 100-pound weights
Right.
if that's not your thing, just adding a small bit of resistance, to build up that bone, to build up that bone density. And you'll also realize that when you start doing this, the weight training, even if it's a small amount of weights, that you're going to increase your metabolic rate as well, right? Because
Right.
you're going to
Good
break down
point.
the muscle.
Absolutely. Great point.
You're going to break down the muscle and you're going to rebuild that muscle, and that's going to lead to increase in metabolic rate. And that's going to help women as we get into menopause and we start to gain weight because of the decline in estrogen. That exercise is really going to be helpful and key in helping to maintain a good weight for us. Really quick before we go, I'm wondering if what you think about in-body scans versus BMIs.
Um, s- so we might have to do another podcast for that. So a couple of things with that is I don't even know where to start with this. So the BMI, while useful, doesn't really take into account body type.
Right.
And Black women can have body type and carry fat in different places. And um, so there's that. Okay. So I think we have not developed a great tool that's universal for all cultures and all peoples, and most things still more than 95% of them are based on a white standard and then are extrapolated or applied to all the rest of us.
Yeah. Yeah, 100%. And, I mean, I don't even want to touch, the racism and all of the practices that they did on Black women
Mhm.
throughout the ages, right? And especially in gynecology, so
Right.
much trauma that women suffered, Black women
Yeah.
suffered needlessly at the hands of white practitioners and the surgeries that were done on them, the practices that were done on them without their consent, without anesthesia.
Mhm.
I mean, just really, really awful.
Right.
So,
Not empowered slaves. You're not able to give consent. You are is just a savage, brutal system, dehumanizing, painful, cruel. I just can go on and on, but you are correct.
yeah, yeah. So you're absolutely right that first of all, the research never really included women to begin with. And
Mhm.
when it started to include women, it was never women of color. It was always just white women. So everything that we have, all the information that we have is, based on white Caucasian
Right.
experiences. And so that's where I really applaud you and the work that you're doing, right? Incorporating women of color into research because it's really important that we have information and research on that. I mean, we can go on and on about why certain things get funded and why others don't, and who's the population that is going to benefit from research and who isn't, and this and that. But anyways, really important work that you're doing. So thank you so much for all you're doing. And I know that we haven't even touched the surface. I mean, you're doing so much work in all phases of life, whether it's advocacy, research, like you said, research and development, just your own shows that you've put together. I mean, gosh, there's so much that you're doing. So thank you so much for all that you are doing. Before we go, I'd love for the listeners and the viewers out there that are thinking, wow, Dr. Jayne Morgan is amazing. How can I follow her? How can I watch everything that she's doing? How can I know? How can I even get in touch with her? What would you say?
Yes. Listen, follow me on Instagram, Dr. Jayne Morgan, DrJayneMorgan. Also do a lot on LinkedIn, Jayne Morgan MD. My first name has a Y in it, Jayne. But you can find me on other places as well. If you're not on either of those, but you're on TikTok or X or Threads, you can follow me there as well, even YouTube. So I am all over social media. Look for me. I do something called the Stairwell Chronicles every Wednesday. I sit on my steps and I talk to you for 60 seconds about one particular medical topic. I make it easy to understand. I'm in and out in 60 seconds. I call it Wellness Wednesday. It's called the Stairwell Chronicles. I sit on my steps on Wednesdays. Submit a question. I might create a Stairwell Chronicle just for you. Answer your question on Wednesday. Look out for it.
Thank you so much for telling us about that, because I did see that when I was researching you. I'm like, Stairwell Chronicles, what is that? So thank you for bringing that up. And well, this has been absolutely fascinating. And thank you so, so much for being this amazing woman and for doing all the work that you are doing and how you are changing the future and the narrative for heart health in women. So thank you so much. I can I ask you one quick question before, before we go? I just thought of it. What do you think about testosterone in women? And does it affect the heart? Does it help? Does it hinder? I mean, I know it helps with muscle mass and libido. What would you say in terms of the heart?
Yeah, I mean, I think, we actually have more testosterone in our bodies than
Yes.
estrogen. And so, again, I think it is worth the conversation for you all to have it, not to be afraid of testosterone, not to be afraid of estrogen. These are all hormones that are in our body. And yes, ladies, we do have testosterone. We have quite a bit of it. And we lose testosterone as well, which is part of that muscle mass loss as we get older.
Yeah, fantastic. Well, thank you so much. And well, we are done here, and it's been real and really intimate. And of course, this was not meant to be any type of medical advice. So please speak with your healthcare provider if you have any questions about your heart, your health, or anything else. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.